That cartilaginous cup now is going to progress and is going to develop because the cartilage doesn't have vessels and doesn't have nerves. But that cartilaginous cup is going to progress and is going to produce, it's going to transform the cartilage in a bone. So vessels are going to get there and small nerves are going to get there in that small piece of bone. But that piece of bone is now inside of the canal. And what is going to happen is going to create a spur. And that spur with time is going to grow, and the caliber of the canal is going to be reduced by that abnormal growth. That is what we call spinal stenosis. The caliber of the canal is being reduced by another structure, at this time a piece of bone. The problem that we have now is when that happens in our life several times, different areas are being injured. And when we reach 70 years old, it's a lot of those small spurs that they are penetrating inside of the canal. In some people are very massive, in some other people a bit less, depending on what type of job you had in life. Is different somebody who has all his life office work with somebody who is an automobile mechanic. So the damage on that spine becomes now a situation where the people is going to be suffering for a misadjustment of the nerves that they leave the spinal cord and they enter the canals that we call the neuroforamen. And the neuroforamen has to match the exit of the nerve with the bony canal that is coming towards the vertebra. That match is very important because if you have now on the bone of the vertebra a piece of bone that is affecting the neurocanal and reducing the caliber of the neurocanal, that nerve is going to be affected in their function. And the function of that nerve is going to be limited. Initially, it's going to be a back pain. And then it's going to be back pain with a problem going towards in a specific nerve. If it is the fifth nerve, the pain is going to go towards the hip. So if this is being ignored, then the canal becomes narrower and narrower, and then that nerve suddenly become affected to a level that become some misfunction. The pain is one of the problems, but the major problem that happens on the elderly is that the nerves start to lose power. And then the consequence of that is that the people start to talk about, I'm getting old. And no, you are not getting old. What you are getting is your nerves are being affected and they are not performing normal. So this is a situation that when happens to different nerves, then the knees are not going to work because the canal of the nerves on the fourth nerve and the third nerve are going to be decreased, and the nerve power is going to be decreased. The quadricep muscle is going to be very poor, and because the quadricep muscle cannot protect the knee, is going to be a degenerative change on that knee. And that degeneration on that knee is going to affect, not only create pain, but now is going to affect the structure. And once the structure is affected and gets to an orthopedic surgeon who sees the structure affected or deformed, then a total knee replacement is going to be a solution. So what you need to do is you need to understand that that is going to happen if you don't take care of this situation sooner and instead to wait longer. So hip problems and knee problems are associated very much with this type of a situation that is a lack of performance or decreased performance of the nerve structure that gives power to the muscle to protect the joints. Now, if that happens, then you may have an MRI and you look at the MRI and you will see a tremendous amount of decrease of the canal. And the people will look in, oh, you do have a spinal stenosis. Yes, we know that we have a spinal stenosis. The consequence of that spinal stenosis is decreased function on the nerve. And the consequence of decreased function on the nerve is that the person is not going to be able to perform normal activities. So you can see these people that walk in the mall with canes is because they have that problem. Or you see people that walk in the mall with scraping practically their feet on the floor and using walkers. That is the problem. Or you have people that are in a wheelchair. That means it's more advanced that they ignore longer the problem and the problem was not treated. So this now is the end of that situation where the nerve claudicates. Once the nerve claudicates, then the patient practically is a wheelchair bound. So today, with the techniques that we develop at the Institute, we can return those nerves to be normal again. And we treat around 80,000 people. 80,000 procedures were performed in this facility. The majority of the problems that we found were always nerve compressions. And those nerve compressions create deficits on the nerve. So people have problems on the hand, they lose the power of the hand. People have problems on the knees, they cannot stand up, they cannot climb stairs. People have problems on the hips, they cannot walk distance. People have problems on the feet, they slap the foot when they walk and that is being called a foot drop. All these things are mechanical problems that today, luckily of us, that we have techniques. Major of these techniques were developed at the Institute. At the Institute, we create the tube that today is being used in different type of surgeries. And the idea was, don't cut open the body. Use a telescopic tube that allows to expand the skin and allow to put the tube and put the instruments and the scopes inside that allowed us not only to perform better, but also to look better and to understand the problems better. That technique was developed here at the Institute and today is going all over the world in a different specialties. We start on the spine and everybody thought that was crazy, and today is all over the world being used that technique. The same thing that happens when we develop the carpal tunnel. Carpal tunnel syndrome before requires a large incision on the hand that usually create bad scar and create problems with the skin in some people. Well, we develop a technique to open a very small incision the size of our small finger nail. And we put a tube that went inside of the canal, and using a knife that is a hook knife, we cut the carpal, the carpal ligament. And then the results were so amazing without practically doing any damage to the hand. We're able to do that. We develop and create that technique. That technique was then presented in a conference. And that conference brought people that they developed that technique, and today is all over the world. That technique for a carpal tunnel, that's the way that the people is being treated now. So when we start to do spine surgery, I said we are going to do it with the patient awake, and everybody thought that was absolutely impossible. Today, the conscious sedation procedure is being used more and more, because not only we prevent problems associated with anesthesia, and at the same time problems associated with long period of patients going to sleep. So the conscious sedation is not only a solution, it's an incredible solution to prevent patients to get harm. So this is what I'm telling you that we develop here. And every time that we develop something, it's always an uproar saying, you cannot do that. And yes, we did it. And yes, they copy. And yes, that work. So that is why we are going to start to tackle every one of these type of problems that they affect the spine, that the people in the market, surgeons are saying, with this one we cannot help you, or we cannot do better, except that you need to take pain medication or so. So I think today that is what I want to do. Tomorrow we'll talk about another type of a problem associated with we cannot help you with that. Thank you.
To find out more about spinal stenosis, to see if you have it or to see if you're a candidate of the Bonati spine procedures, reach out to the number below or visit askbonati.com. We will see you tomorrow.